And I've just admitted somebody else. So I think, oh, Samantha said hi in the chat. One more thing for me to click on. Welcome, everybody. So my name is Dr. Carolyn Higdon, if you've not been with us before for Wednesday night office hours. So I will just do about 2 or 3 minutes of introduction, and then I'll let people in as they arrive, and Dr. Hinton can start her presentation. So I am not Betsy Pendry. I'm Carolyn Higdon, and I'm the lead organizer for the speech language pathology part of Therapy Ed. We're doing it a little bit differently this year. I don't know if anybody talked to last year's cohort or students about what we did, but this year we are posting a video about an hour long of the content 1 week before the office hours. So in other words, Alice's presentation was posted last Wednesday with the content. And then we're going to spend the time in the office hours with just a very quick review and then a lot of Q&A. So we have a lot of questions that are very similar to the ones on the Praxis. And so we're going to use those, and she will discuss those and tell you answers and try to give you rationale. So it's really a two-part piece. This year, we're trying that to see. The third piece is that we're starting to offer individual tutoring and help for people who feel that they need it in certain areas. So when I get off, I'll put my email in the chat. And if you can pass word around to any of your friends, they feel like they need individual help, we can make some schedule and make those arrangements. The last thing I would tell you is that if you have not already gotten it, the Therapy Ed app, which is on sale on the Therapy Ed website, is very useful and can really, in addition to the book, can really add a lot to your studying. And in the book, of course, the Therapy Ed book, there are practice tests, and the people that developed that book did a lot of the input of questions from ASHA to the Praxis committee. And so we have a lot of similarity in across the book, the app, and the kind of questions that you get in office hours. So anyway, that's my introduction. We'll be recording, and of course the recordings will be posted after class tonight. So I will turn it over to Dr. Hinton. She can give you a little bit about her background and where she is, and she can take it from there. And I just
All
brought
right.
somebody else in, so it's all yours, Alice.
All right, thanks. Hi, everybody. I'm glad you're here tonight. I'm Dr. Alice Hinton, and I am an associate professor at the University of Montevallo, which is in Alabama, just south of Birmingham. I've been lots of places around the South. I've worked in universities, I've worked in public schools, I've worked in residential severe to profound intellectual disability facilities. Um, my favorite areas of clinical practice are in speech sound disorders. I like hearing loss, um, voice resonance, those kinds of topics in clinic, primarily hearing loss and some of the more complex speech sound disorders. Um, at the University of Montevallo, I teach undergraduate speech science, anatomy and physiology, audiology, and auditory rehabilitation. And then at the graduate level, I teach motor speech disorders and cleft palate and craniofacial diagnoses. So kind of all over the place, but a lot of common threads through some of those courses as well. I do love teaching the speech science course with acoustics and spectrograms and such, so I'm glad you're here to talk through some of these topics tonight. If you think of questions, put them in the chat and I will try to get those addressed. Maybe Dr. Higdon can help me watch for things to pop up in the chat. But I will try to watch for those. And I have a short review. As Dr. Higdon said, I've done a PowerPoint with the voiceover, and that has been posted for a week or so now, and you've got access to that. So I'm not going to go back through all of those topics, but just a little bit of an overview of kind of how the review chapter in the therapy ed praxis guide, the review chapter on acoustics is set up with some of the themes, some of the big concepts in that chapter. And then I have a series of questions that we can go through for some practice. So as you may remember from your class, it was probably called a speech science or speech and hearing science, speech and voice science. What else is there? Acoustics, physics of speech and hearing, whatever you called it, possibly undergrad or grad level, depending on your university. This course covers the nature of hearing, or nature of sound, rather, excuse me. So that's the concepts behind, what makes it a sound, how does sound travel, how does the medium affect how sound travels. There are a lot of terms like frequency and intensity and the kind of wave. Is it a longitudinal wave or a transverse wave? We have complex waves and simple waves and sinusoidal waves. We can talk about the wavelength of a particular sound wave. Decibel scales would also kind of fall under this nature of sound category. And then periodic and aperiodic sounds, which start to get us into more of the speech component of sound. So then there are different kinds of graphs, different ways that we can represent these sounds. We can look at sounds in waveforms, or we can look at them on a spectrum that's usually an amplitude spectrum, or we can look at spectrographs. And that's probably what you spent most of your class, or about half of your class anyway, working on when you took this course in your program, was reading spectrograph images and deciphering what the sound was, or analyzing some aspect of the voice using that particular graph. So that's a good bit of it toward the end of the concept. So then we have the source filter theory, which is really kind of the foundation or the core of this entire unit. So you'll see this is the source filter theory of speech production. So this is dividing up the sound according to the source, which is created by the air column that's moving from the lungs through the trachea, through the larynx, where it's set into motion by the vibrating vocal folds. So we have this sound wave, this pressure wave that's moving through. And then as it goes through the vocal folds and gets into the vocal tract, which is above the level of the vocal folds, this particular review calls it the supralaryngeal vocal tract. You get into that piece of it, and that's the filter. So that air column gets shaped in some way by tongue placement, or the shape of the oral cavity, or whether you have resonance in the nasal cavity. What is that velum doing? Is it letting air into nasal cavity, or is it closed off? Are you making a constriction for a fricative or for a stop plosive sound? What are you doing with the sound as it's moving through your mouth? And that's the filter piece of it. And that's shaping the resonance of that sound that we then interpret as speech. So then we get to the acoustics of speech sounds. And this part of the chapter and of the topic really looks at what's happening with that source and filter. What are we seeing in the spectrogram that can tell us what's happening in the source or the filter? How are all of those components to the speech system working together? Um, so I always think of it as, as you're going through the early classes in speech pathology, you take a phonetics class and you learn about all of the categories of sounds and um, how they're made differently in the mouth, and you learn to discriminate each of those auditorily. And then you take an articulation class and you learn more about the place, manner, and voicing of the sounds. And we're learning things kind of in this sort of a longitudinal way. You're looking at each topic just as it's going through, looking talking about the phonetic placement of it, or the um, where it is in your mouth and how we attach that to a particular word, and what happens when that sound is different in a word, and then you get an articulation disorder. So we're kind of looking at it through a different lens for each course. When we get to the speech science, we take all of those like they're almost like they're lined up parallel to each other, and then we look at it as a cross section. So we have our articulation, and we have the phonetic symbols, and we have our place, manner, and voicing, and we have everything we know about the nature of sound that we might have gotten from an audiology class, or maybe just from the first unit of the speech science course. So we have all of that information together, and we start looking at how it all comes together in a moment of time, how all of those things are working together. So it's kind of like taking all of those topics and looking at them sideways almost. Um, so uh, acoustics of each of those categories of our speech sounds. So what are the acoustics of the category of stops or plosives? What are the acoustics of our fricatives, our nasal sounds, our liquids? What makes them different acoustically? Um, and what does it look like on a spectrogram? So that's where we will end up. Let's see, I'm not seeing any questions yet, so I'm just going to go right on into our into the questions that I have prepared. So first one, in sound vibration, what term refers to an area of higher density and pressure? Um, why don't we try putting answers in the chat? There we go. All right. Correct answer is B, condensation. So that area of higher pressure in a sound wave is that compression or condensation area, and where it's farther apart is the rarefaction piece. So our sound wave moves as alternating areas of compression or condensation, and then rarefaction. All right, so second question, what is frequency? B is the correct answer on that one as well. So frequency is defined as the number of repetitions of a cyclic pattern in 1 second. So we typically measure frequency in hertz. So hertz is the number of cycles per second. That's what that's defined as. So we're measuring the number of those alternating condensation, rarefaction cycles. How many times do we go back and forth with one of those? One condensation and one rarefaction would be one cycle. So how many of those cycles do we have per second? And that's our frequency of that sound wave. All right. What term refers to the distance traveled by a sound during a single cycle? C is the correct answer on that one. Y'all are doing great. So the terms kind of give it away on that one, I hope. So wavelength, length is a measurement of distance. So what term refers, okay, just said that, refers to the distance traveled by a sound during a cycle. So we have a condensation rarefaction is one cycle, and how far does that wave actually move as it's moving from that sound source and moving off into space or through whatever medium it's traveling through. How far does it actually go by the end of that cycle is the wavelength. All right. For what purpose would a narrowband spectrogram be used? All right, correct answer on this one is C. So the best answer for this one would be to use a narrowband spectrogram for checking the pitch contour accuracy. So if you remember, when we talk about spectrograms, we're usually looking at either wideband or narrowband spectrograms. The wideband or broadband spectrogram is the let me explain the other one first. I think it'll make more sense. The narrowband spectrogram lets narrow bands of frequencies pass through a filter. So the sound is moving through a filter in whatever the sound processing system is. It's being analyzed according to certain little bands of frequencies. So in our speech, we have a lot of different frequencies happening at once. We have all of our resonances and we're changing the pitch of our voice. We have harmonics in our voices. We have a lot of things happening at one time. So we've got a lot of frequencies to look at. And the narrow band breaks those down into little pieces. So when you look at that spectrogram, it really looks like you're seeing these lines going up the vertical column of that spectrogram. If you remember, spectrograms have time on the horizontal axis and frequency on the vertical axis. So as you're looking at a unit of time there, one little second or one little instance of time, you're seeing all of the frequencies that happened at that particular instant. So narrowband, you're seeing all of those little lines. It's trying to think of another way to describe it. It's like, looking through a comb or something. You're seeing all of those bars there. When you look at a wideband, those those boundaries just get smoothed. So you're looking at all of the frequencies and you can see more subtle changes. But that pitch contour is going to show up a little bit better with the narrowband filter than it is with a wideband. So wideband, it's easier to see some of the format changes. It may be easier to detect the manner of articulation, but pitch contour is going to be easier to see with narrowband. All right, next one. What is a sinusoid? A sinusoid is a sound consisting of a single frequency. So answer B is your best option on that one. A sine wave is a simple wave. It is not a complex sound. It is a single frequency, so it looks like a very simple waveform. Just one crest and a trough, and then a crest and a trough, and it doesn't change. It's just um, simple and repeats. The pattern is not complex at all. So that's what we see when we have a pure tone. So if you're testing hearing or doing a hearing screening with pure tone screeners, pure tone audiometry, we use simple waves, pure tones, a sinusoid wave at whatever frequency we're testing. If we're screening at a thousand hertz or 2000 hertz, it's going to be a very simple single frequency there, and that's going to look like a sine wave. All right, next one. In the source filter theory of speech production, what acts as the filter? It is the supralaryngeal vocal tract, so it's everything above the level of the vocal folds, between the vocal folds and your lips, where that sound starts coming out of your face and out into the world. Um, that is the space that we define as the filter. All right, y'all are doing great. So what would act as the source? A is the best answer on this one as well. So some references that you might see may consider the lungs and the vocal folds all part of that source. Some of them will say that the lungs are providing the power for the source, um, which is in the vocal folds. They're in the larynx. Um, but you have to have all of those together. If that air is not moving through, you're not going to get vibration. So all of that has to happen in order for you to get that source piece of it. So that is um, the vocal fold vibration is the source of the sound. All right, formant 1 is most closely associated with which factor? Formant 1 is most closely associated with pharynx size. So yeah, y'all got that one. Formants again are those areas of resonance. It's where a particular frequency in that sound is the the most resonant. So depending on the shape of your filter, depending on what's going on in that vocal tract, you're going to have different frequencies that fit in that space better. You'll have different frequencies that resonate in that cavity. So bigger cavity, you get certain frequencies, smaller cavity, certain frequencies. Um, and that's what creates these formants. So when we look at spectrograms, we're looking at those formants, which are going to show up as darker areas, so higher energy areas on that spectrogram. And the first formant is the lowest frequency resonating space. So that is most closely associated with pharynx size. All right, so how about the third formant? What is F3 most closely associated with? Yeah, so um, best answer on this one is answer C. Um, Third formant, we don't really use much for discriminating vowels. It's there, we can measure it, we can see it on a spectrogram, but it's not as critical for discriminating one vowel from another vowel, but it is critical for recognizing that retroflexed R. Um, let's see, I think I've got another question about that, so I'm not going to explain too much yet. Um, Nasal consonants have a complete closure in which location? Yeah, you've got it. It's in the oral cavity. We've got a complete closure there, and that's going to force the air column up into that nasal cavity. So we get nasal resonance there. Um, but that sound is not coming out the mouth like the sounds that have oral resonance would ultimately be exiting out the mouth. So nasal consonants um, are blocked there. So y'all are getting this. All right, next one. What is a distinguishing feature of R on spectrographic analysis? Mm, no guesses. Um, so this one is the low third formant, a low F3. So answer D is your best option on that one. Um, so with spectrogram, with our production on a spectrogram, we're looking to see that that third formant drops down really, really low. Um, if if it doesn't, that our production is going to sound more like a vowel or more like a w. So it's going to sound not as clear, not as crisp as a good retroflexed R. So we look for that low F3. So that gives us spectrograms as a good way to give feedback, to give biofeedback for kiddos who are working on R's in speech therapy. We can watch for that to come down and give them that cue for their correct production. All right, next one. What is a characteristic of stop consonants on a spectrogram? Stop consonants, we do see a period of silence followed by a burst. So just like you learned in your phonetics class, that's how we make that category of sounds. We close the air off and then we let the pressure build up and then we let it all out at one time. And that's this whole category of stops or plosives. Um, so that's how we make them. And we see that happen when we look at a spectrogram because that's showing us what's happening with the sound. So we see this period of silence that's called a stop gap. We see that block where there's not really any sound, and then we have this sudden burst of sound energy, burst of acoustic energy there. And that's our cue. If we're not able to actually hear it, that's our cue on that print, that that's what was happening in that speaker's vocal tract at that point. Okay, next one. What is a distinguishing feature between voiced and voiceless obstruent cognate pairs? How can we tell a difference between voiced and voiceless obstruent sounds? Let's see. Best answer on this one is B. So our voiced obstruents have a shorter duration than our voiceless ones. So you can practice this by contrasting, think of a minimal pair that has a voiced obstruent and then the same placement, same manner, but it's voiceless in the second cognate, in the second word in the pair. So say each of those, one after the other, and you can probably hear and feel a little bit of a difference in that. And our voiced ones are going to be a little bit shorter. With the with the voiceless, we tend to take a little bit longer getting that voiceless sound out. And it's like we're trying to give the auditory system a little bit longer to catch what that sound actually is, because we don't have the voice piece with it. So we kind of trade off a little bit on how long that sound is, and that helps our auditory system with that discrimination. Just giving us a little bit longer to make the choice and that determination. Okay. What would be the distinguishing feature between sibilant and non-sibilant fricatives? Any guesses? Best answer on this one is C. Our sibilant fricatives have higher amplitude noise than non-sibilant fricatives. So our sibilants are s, z, sh, and zh. So our non-sibilant fricatives are going to be f, v, th, th. So FV, the THs and the H would be our non-sibilants, SZ, SH, and then the voiced palatal there would be our sibilant fricatives. And if you look at those on a spectrogram, you can see higher frequency noise on the sibilants, on the S and the Z and the SH. You can see higher frequency sound energy than on the others. On the others, we have lower frequency and more diffuse, I guess, energy. It's just a little less concentrated. With those sibilants, it's more distinct. There's a band. It's a wider band, but it's definitely there. And you can hear that when somebody says those sounds, you can hear a difference in those pitches, even for the non-voiced ones. So s, sh versus f, f. I hope you can hear a little bit of a pitch difference with that. If it's not coming through the speakers, try those on your own and see if you can hear a difference in pitch. So that shows up in the spectrogram in higher frequency and higher amplitude noise. It's just louder. It's just higher frequency. It's a louder sound. It's going to show up as a darker, more intense resonance space on those spectrograms. So higher amplitude, and it is also higher frequency. All right. What do changes in mode of vocal fold vibration correlate with? So you may remember learning about different modes of vibration or modes of phonation. That corresponds to what we describe as spectral tilt. Yeah, so y'all are remembering these very well. Cycle to cycle variability in frequency. Remember this one? Correct. That's our definition of jitter. Variability in frequency, when that frequency changes from one cycle to the next. So there are certain voice disorders where you hear that frequency becoming less stable and you hear a lot of variation. If someone holds out an ah sound on an oral mech or on a speech motor test, you have them hold out an ah, and you can hear that frequency changing. It gets a higher pitch and then it'll get lower pitch and then higher and lower. And when that changes really quickly, you have greater amounts of jitter in that voice. All right, so how about cycle to cycle variability and amplitude? Absolutely, that one is shimmer. So this variability, the sound gets louder and then softer and then louder and softer. So um, similar variability that can happen with um, we have some age-related changes, we have some diagnosis-related changes sometimes that can lead to that vocal fold vibration just being less steady over time, and you can hear that and measure that with a sustained vowel sound like a sustained ah or a sustained e. Um, okay. Which of the following is true regarding voice onset time for stop consonants? Let's see who remembers voice onset time. Yay, you got it. Best answer on this is B, correct. Our bilabial stops have a shorter voice onset time than the alveolar stops. It's shorter than the velars as well. When you're comparing the voice onset time of stops with the same voicing. So if you're comparing a voiced bilabial to a voiced alveolar or a voiced velar, you're going to have a shorter voice onset time with the bilabials. Our velars tend to have the longest voice onset time. So reminder, voice onset time is the time between the release of that stop closure. So remember with our stop consonants, we have stopped the airflow for a period of time and then released that pressure suddenly. So we've got that sudden burst of energy. So we've got the stop gap and then the release. So the voice onset time is the time between that release of the stop and the onset of voicing. If that voicing starts either before the release, at the same time as the release, or immediately after, like within a few milliseconds, right after that release, we process that as a voiced sound. And if the voice onset time is longer, if the voicing doesn't start until well after that release, then our ears, our auditory system processes it as a voiceless stop. It's like our brain is saying, "Oh, I hear the voicing coming in, but it didn't happen real close to that same time as the rest of that stop. So that voicing must go with the next sound, or it's gonna go with the vowel or with the L or the R or whatever is in the blend. It's gonna go with the next um, phoneme instead of with that stop." So that's our voice onset time. So bilabial stops have a shorter voice onset time than the alveolars. Okay. What is an appropriate description for the effect a stop burst of a bilabial consonant has on a spectrogram? Appropriate description for the effect that burst has on a spectrogram. That stop burst is more likely to be a flat spectrogram, more diffuse, so that energy that's just fairly diffuse across um, all of that time. It's going to look fairly consistent. So that's what's happening with that energy that's contained in that burst of energy, in that noise burst. Um, it's fairly diffuse. Um, the frequencies aren't focused in one particular area. It's just noise across all of the frequencies. All right. What is a nasal formant? So yeah, lots of words on there. It takes a little longer to read some of these. But yeah, the best answer for this one is B, a nasal formant. So the energy for that nasal sound, the resonance energy for that is low frequency. So all of our nasals tend to have that low frequency signature. You may remember it being called a nasal murmur. That is that low frequency formant. And we get low frequency because the nasal cavity is opened up for production of these sounds. So we've opened up the velopharyngeal passageway there, air is coming up. So we have a larger resonating space than we would have had in the oral cavity. So when we have a larger space, we get lower frequency sounds that resonate in that space. If you remember the relationship between frequency and wavelength, when we have a lower frequency sound, we have a longer wavelength. So if you think about a longer wavelength fitting into a bigger space, um, that's easier for me to visualize and kind of make that association with what's happening with those nasal sounds. It's a larger cavity, so we get a longer wavelength, which translates to a lower frequency that's going to be most resonant in that space. So best answer for that one is B. Low frequency formant caused by a large vibrating pocket of air in the nasal cavity. All right. Um, we got through those much faster than I was expecting to. Anyone have any topics that you want me to discuss in more detail? Any terms in these questions that maybe are a little dustier in your mind than you had hoped. I'm gonna look back in the book here and see what else we have. So we've talked about source filter, we've talked about the different categories of phonemes. One concept that didn't come up in these questions, um, I'm pretty sure it was in the recording, um, is the idea that the vocal tract is a quarter wavelength resonator. That's another pretty important concept for understanding source filter theory and how that connects to speech. So quarter wavelength resonator, meaning 1/4 or a quarter of the wave length is going to resonate the most easily in um, in the vocal tract. So we have waves that have nodes and antinodes. So the node is the area where we have the least amount of movement, and that happens at the level of the vocal folds. And then we have the antinode, which is a quarter. The first antinode is a quarter of the way through that first wavelength. So that happens at the level of the lips. And when we have that shape, that frequency in that space, it's more resonant. When we have a sound wave that ends on a node at the level of the lips, it tends to lose energy and it just doesn't get amplified, but that quarter wavelength gets amplified because some of that sound exits the mouth at that point, but some of it also gets reflected back. So if you remember when you were learning about source filter theory and that transfer function, one other piece of it is the boost of energy that you get, that radiating boost of energy as the sound wave leaves the mouth. And part of that is because of that little bit of reflection that we get as some of that sound gets reflected back and gets amplified again before it comes out. So we're getting a little bit of an amplitude gain, a little bit of an energy boost there. And that's related to that quarter wavelength resonator. Um, so quarter wavelength and then the odd multiples of that will get the same shape. So 1/4, 3/4, 5/4 will get that same shape where you end at an antinode at the level of the lips. So that's another important piece for understanding source filter theory. So question here, is there ever actual math to do related on that to the praxis? I don't believe I can say that uh, I can't tell you that there isn't.
Yeah, I'll jump in there, Alice, if you want
Thank
me to
you.
for a second. So there may be some basic scratching that you have to do, some basic, math figuring. So I believe that you can now have scratch paper or they give you something to write on. So I wouldn't rule it out. Um, I think there is the students I've talked to recently have said there's some figuring that has to go on across the test.
Yeah. Yeah, that's kind of what I was thinking. I think you should be prepared for some of that, some basic relationships like calculating a frequency or um, number of cycles in a second represented in a picture, those kinds of things. Um, but I can't imagine that there would be anything super complex, nothing that you would need a calculator for or anything. Things you should be able to do fairly easily, either in your head or with a little bit of scratch paper. Thank you for that question. Anything else that you're thinking of at this point? All right. Going back a little bit to some definitions, um, I mentioned um, periodic and aperiodic sounds, or periodic sounds are things like that sine wave that repeats, any sound or any wave that repeats is considered periodic if the pattern of that wave repeats. So pure tones are going to be periodic. Complex waves can also be periodic. But complex waves can also be aperiodic. And when those complex waves are aperiodic, we call them noise. But the ones that are periodic are going to be more like speech. Speech is typically described as quasi-periodic. It's not truly periodic, but it's not noise exactly. So we talk about it as if it were periodic. We work with it as if it's more of a periodic sound than an aperiodic sound. Um, let's see. Other so a couple of other definitions that may come up thinking about sound waves. So you have a fundamental frequency, which is related to the length of the resonating body. So the length of the string that the sound that the wave is traveling through, or the length of the vocal tracts, or whatever it is that's vibrating, that's resonating, length of the vocal folds. You'll have a fundamental frequency related to those chambers, to those vibrating bodies. Um, Harmonics are whole number multiples of the fundamental. So we have, an infinite number of harmonics associated with whatever that fundamental frequency is. So our voices will have a fundamental frequency, and then we have all of these harmonics that just happen naturally because of math again, but whole number multiples of that fundamental. So if someone has a fundamental frequency of 250, the 250 hertz, then the harmonics of that fundamental frequency are going to be 500 hertz, 750 hertz, 1000 hertz. So whole number multiples there. A similar term is octave. So an octave is a doubling of frequency. So they're going to be related, but they're not always the same. So go back to that voice with a fundamental frequency of 250. So an octave above that would be 500 hertz, which happens to be the second harmonic as well. But the next octave above that is going to be 1000 hertz, right? So we've jumped up to that fourth harmonic for the second octave, if that makes sense. So it's a doubling of that frequency to get an octave. So you can connect that back to any experience you have with playing a musical instrument or singing. You've had some opportunity to practice and play around with harmonics more, and octaves. We talk about octaves with pianos and with instruments a lot and with vocal music. So those are two terms that are also relevant to voicing. Um, on a spectrogram, you'll see the fundamental frequency as that lowest frequency, the lowest resonance, the not resonance space, but the lowest line. If you're looking at one of those narrow band spectrograms where it looks like it's just been brushed over with a comb, so you've got all those lines in there, that lowest frequency line is going to be your fundamental frequency. So each of those lines is um, they're all evenly spaced, they're the same distance apart, and they just go straight on up that page and up that image. And those are your harmonics in that particular voice. So it makes it easier to determine if that speaker has a lower frequency fundamental or a higher frequency fundamental, because you can see how close together or how far apart those harmonics are. Any other concepts or terms that um, you have questions about or would like for me to review? All right. Dr. Higdon?
Okay. Well, thank you, Dr. Hinton. That was excellent. Really good information and information they'll be able to go back to and review. Um, Remember what I said at the beginning. If people are interested in personal tutoring, please contact me and I will connect you with the right people. Be sure to look at the app, get the app, and as well as the Therapy Ed manual. And then next week we will have a different speaker and a different topic. That's all posted on the Therapy Ed website. So you'll be able to see what's coming up over the next month or so. Again, thank you so much, Dr. Hinton, and good night to everybody. Those of you that return next week, I'll see you.
Thanks for coming.
Thank you.
Thank you.
Okay,
Is that all right?
that was great.
Are we still
I-
recording?
Oh.